O'Keefe.
Thank you. I bring greetings from Wendy Savage and everyone at Keep Our NHS Public. For those of you who don't know us, we're a grassroots campaigning organisation founded in 2005 by the NHS Consultants Association, the NHS Support Federation and Health Emergency. Our focus is to highlight and challenge the creeping privatisation that, as you all know, has been happening within the NHS since 2005, when a commercial market was first introduced into the health service. We support local groups, as many of them here today. We support local groups who work tirelessly in their areas in support of local needs and against ward closures and hospitals, and this is very important, in spreading the knowledge of the quiet transfer of health services to private companies who openly make use of the familiar NHS logo. We consistently network via our extensive contacts of nurses, doctors, consultants, other medical staff, unions, local and national campaigning groups, sympathetic MPs, bloggers and patients. And on the subject of patients, we're all patients, but we are certainly not victims. As you will appreciate, the spin in that white paper, intriguingly called Equity and Excellence, Liberating the NHS. That spin about putting patients at the heart of the NHS and doctors in charge with GP commissioning serves to fully open the door to private companies creaming off the most lucrative aspects of healthcare, and will have far-reaching consequences for continuity of care and for the workload of the profession. This gathering shows that we have no intention of patiently waiting for this disaster of a white paper to further fragment the NHS. We all know that what we're hearing about the NHS being protected is simply not true. The opposite is true. The NHS is being asked to sustain 20 billion worth of cuts and job losses. The use of language such as ring fencing is meaningless, as the cost of drugs and medical equipment rises above the rate of inflation, so effectively more cuts there. And the systematic dismantling of the NHS with the private sector and UK private health companies and US corporations, they're already rubbing their hands. It is noteworthy that the only people to welcome the white paper is the private healthcare industry. Indeed, the MD of Tribal, who described themselves as a leading provider of public services in the UK, he said, "This white paper could amount to the denationalisation of healthcare services in England and is the most important redirection of the NHS in more than a generation." I'm being asked to finish. I had something else to say. I just finished with Nye Bevan. Nye Bevan said, "The NHS will last as long as there are folk left with faith to fight for it."